Ayubowan, I'm Dr. Nimesha Gamhewage, consultant pediatrician. In this video, I'm going to discuss about some common problems encountered by breastfeeding mothers. So one of the common problems most of the time asked from us is how often I should feed my baby. The answer is go for demand feeding. So that means whenever your baby is hungry, you have to offer the breast and give a breastfeeding. That is not 2-hourly feeding, not 3-hourly feeding. So that means whenever baby is hungry or thirsty, baby would show you some hunger cues. And then we should take the baby and offer a breastfeed. Secondly, most of the mothers are not aware of the hunger cues. What are they? That is actually not just crying. Babies open their mouth, starts to rootle, put their tongue out, sometimes take their hand in and start sucking. At the very late stages, when they are very hungry and they actually get angry as well, at that time they start crying. So it's very important to recognize the early features of hunger cues and offer the breast to the baby at that stage. So what if the baby is sleeping? When am I supposed to awake my baby? So generally we know in a good term baby with a good birth weight, it is quite safe to let the baby sleep for about 3.5 hours in the first month of life. But after that time, beyond that point, if we allow the baby to sleep, there's a slight risk of dropping the baby's blood sugar level. So that's important. It's important for you to wake the baby up around 3.5 hours of age, keeping a maximum gap of 4 hours in the first 1 month of life. Most often mothers wonder how to know whether the baby is getting enough breast milk. So there are simple things that we can observe. First of all, how the baby is being fed. So if the baby is attached and well positioned to the breast, they usually are able to finish the breastfeed by about 20, maximum 30 minutes. But if the baby is latched to the breast for a long duration, like 45 minutes, 1 hour, we know the breastfeeding technique is not effective. On the other hand, if the baby falls asleep on the breast, like within 5 minutes, 4 minutes, 3 minutes, then again we know the latching is not good. So therefore the baby is not getting sufficient amount of milk, so the baby falls asleep. Secondly, after a good feed, they generally sleep for about 2 hours, 2.5 hours. So if your baby wakes up very soon after each feed, this could be a sign that the baby is not getting enough milk. And then the urine output also is extremely important. In the first 3 days of life, anyway, there won't be much of a urine. But after that, any baby is expected to pass at least 6 times urine per day. And this has to be diluted and not concentrated. So if your baby is passing concentrated urine or less amounts of urine, like 4-5 times a day, that means your baby is not getting adequate amounts of milk. Please remember, the number of times the baby passes poop is not a good indicator of effective breastfeeding. They can even go without doing a poop for 7 days, but you still be getting enough milk. And finally, the most important indicator is how well the baby is gaining weight. Initially, any baby will drop the weight from the birth weight to a certain extent. And by about 10 days, 14 days, we expect the babies to come back to the birth weight. And after that, in the first month of life, in the first 3 months of life, they are expected to gain at least 25 to 30 grams per day. So if this pattern is not there, that means your baby is not getting sufficient milk. So most of the time, you have enough milk. It's the way that you are giving which is not appropriate or not correct. So it's very important that you take proper advice from expertise and correct yourself. Who are the people who can help you? In all the hospitals, there's a breastfeeding center, there are midwives who can help you, and also doctors can also help you after assessing you and your baby, and especially the breastfeeding technique. So make sure you take adequate support and advice and do the breastfeeding properly and ensure that your baby is growing well in a healthy manner. Thank you.